At this time, I'm very pleased to introduce today's commencement speaker, Dr. Richard Gilfillan. Dr. Gilfillan has led CHE Trinity Health, the parent organization of Mount Carmel Health System, since last November. And yes, he has a very big job. Excuse me. And yes, he has a very, very big job. CHE Trinity Health is the second largest Catholic health delivery system in the country. It serves people and communities in 20 states from coast to coast with 86 hospitals, 109 continuing care facilities, and home health care and hospice programs to provide more than 2.3 million visits annually. It was formed in May of 2013 when Trinity Health and Catholic Health East completed their consolidation to strengthen their shared mission, increase excellence in care, and advance transformative efforts with their united voice. Previously, Dr. Gilfillan was the first director of the Federal Center for Medicare and Medicaid Innovation. While there, he worked with payers and providers to develop innovative models for improving patient care and reducing costs. Prior to CMMI, Dr. Gilfillan was president and CEO of Geisinger Health Plans, where he led the design of new payment systems and medical care initiatives that increased the quality of patient care. He also served as executive vice president of insurance operations for Geisinger Health Systems, and his prior roles included senior vice president for national network management at Coventry Health and early executive position at Independence Blue Cross. Dr. Gilfillan began his career as a family medicine physician. In this role, he practiced in underserved communities in rural Massachusetts and in Trenton, New Jersey. He later became a medical director and chief medical officer and earned his undergraduate medical degrees from Georgetown University and an MBA from the Wharton School at the University of Pennsylvania. Please join me in welcoming this year's commencement speaker, Dr. Richard Gilfillan.
Thank you very much, Michael. I'm thrilled to be here, and thank you all for that warm welcome. It really is a great honor to be here with you today and share this exciting day. Gary Trudeau, the founder of, or the creator of Doonesbury, once said, "Commencement speeches were invented in the belief that outgoing college students should never be released into the world until they had been properly sedated." I'll try to keep my remarks short. So congratulations, graduates, all 244 of you. We've heard that you make up the largest baccalaureate nursing program in Ohio. You're also in the top 10% of nursing programs across the country. It's an impressive statistic and a testament to the fine leadership of Dr. Sheely and the rest of the faculty. And I want to just once again congratulate her on 53 years of outstanding leadership. I've learned today she is my model and my mentor. She's going to continue working once she finishes here and sets, I think, a great example for all of us about the opportunity and the excitement, the thrills of continuing to participate in transforming our healthcare system. Parents, grandparents, brothers, sisters, family, and friends, thank you all for supporting these young ladies and young men in so many ways during their long journey. They're here because of you, and now they have become your gifts to the world. I want to take a special moment and say congratulations and thank you to my cousin Stella and her husband Mark. Their son, Chris Simmons, is graduating in the class today. I'm sure if you know Chris, you realize that he's the quiet, laid-back person I met last night at dinner for the second time. But what a wonderful job, Stella and Mark. And I didn't know that Mark was in the class, but I also learned last night that he's actually one of the Trinity Fellows, or scholars, receiving financial aid from CHE Trinity. So a remarkable set of coincidences in this small world of healthcare. I have 4 children myself, all of whom graduated from college, so I have some sense of the pride and sense of satisfaction that you as parents have today. I also have this vague memory of a sudden increase in what I would call my keepable take-home pay following this day. It's a nice little bonus. Graduates, happy Nurses Week. This is your week where we celebrate all that has been done following nursing over the last 100+ years. And congratulations on achieving your dream. You're joining a noble profession. For the rest of your life, you'll have the ability and the privilege to provide a healing, comforting touch to people when they're most in need. Your profession is steeped in honor, bound by a long tradition of selfless service. It's a calling to work that's extraordinarily rewarding. It's not extravagantly rewarded. Thank you for answering that calling. In doing so, you've honored the rich legacy of the Sisters of the Holy Cross, the founders of your school, the founders that Sister Barbara represent and mention. Of course, they answered an even more remarkable calling. Imagine it is 1861 and the Civil War is raging. More than 620,000 soldiers will die or be wounded during the course of the war. The USS Red Rover, a Confederate ship, is captured by the U.S. Navy and refitted to become the U.S. Navy's first hospital ship. Its mission is to care for the sick and injured, Confederate and Union alike, all along the Mississippi. Sister Angela of the Sisters of the Holy Cross heard a calling. She contacted the Union Army and asked if she could provide staff for that first ever floating hospital ship. 4 sisters volunteered and they answered that calling. Trained as teachers, not nurses, they nevertheless head off down the Mississippi, learning on the job, facing the horrific injuries in the most horrible war of all wars up to that time. It was a remarkable act of heroism. Your legacy begins with these risk-taking women who were bold, biased to action, and innovative. These sisters on a boat needed no one to tell them to lean in. It was their nature. After the war, these women became the founders of Holy Cross Healthcare, as well as the forerunners of the U.S. Navy Nurse Corps. In 1903, they established the Mount Carmel School of Nursing. So, you've attended a fabulous nursing college created by energetic, bold, nurturing women whose successors, like Sister Barbara, continue to this day to live up to that tremendous legacy. Catholic healthcare in America is the legacy of many sisters on boats who came to America to serve. Like the Holy Cross sisters, most did not start as nurses. They came to serve vulnerable people, ultimately realizing that healthcare was a great way to do it. The Sisters of Holy Cross, Mercy, Our Lady of Providence, Charity, and Franciscan sisters all followed similar paths of creating clinics and then hospitals. Today, the systems founded by these extraordinary women provide 15% of all American healthcare. It is the single largest component of our healthcare system, all the result of work started by small groups of 2, 3, 4 sisters coming off boats from Europe. Excuse me. Now, 152 years later, we're here to celebrate your launch into the wonderful modern world of nursing and healthcare. You've made a great personal career choice. Nursing provides many different career options. Many of my nursing friends from college followed very different paths. Lactation counselors, community health nurses, acute care nursing, founders of inner city primary care clinics, hospital CEOs. Melanie Dreyer, the chairman of the CHE Trinity Board, is a nurse PhD. And of course, Marilyn Tavener, the administrator of CMS, probably the most important position and influential positions in American healthcare, was an ICU nurse. Nursing is a career bound by no limits. And of course, nursing provides the flexibility to accommodate many different lifestyle choices. As was the case 150 years ago, today your communities in your country need you. We call on you today to do 2 things. First, to continue providing great care in the legacy that you have here at Mount Carmel. But second, and critically important, we call on you to help us change the way we deliver care in America. Our healthcare system is in the midst of a significant change. We need to dramatically change the way we deliver care in all of our communities. We can no longer afford to provide care the way we have in the past. We need to make care better, we need to make it more about patients, and we need to make it affordable and accessible to everyone. We've called this a movement from a producer or a provider-centered system, where we built a system around the way we as doctors, nurses, hospital administrators wanted people to get care, to a system designed to give people the care when they need it, how they want to get it. We call this a provider-centered system moving to a people-centered system. As we go about that work of redesigning our system, nursing needs to be at the table. You will be central to our success. And there's many reasons for why you need to be there, why you need to be part of this. But they all come down to one fundamental reality. You touch patients the most. You are the most effective patient advocates and guardians of patient safety. We need you as the conscience of our redesign efforts to ensure that we really are people-centered. The reality is, this is going to open up another new world of possibilities for you all as you enter your career. Klaus and I this morning were talking with a group of doctors about new ways we can deliver care and the central role that nurses will play in navigating patients through the system, managing the highest risk patients. Also to be noted, of course, is as we change our system, less care will be delivered in hospitals, more in the community. The location of nurses today, centered, focused in hospitals, will change and become much more dispersed over the next 5 years, leaving behind, by the way, only the sickest people in hospitals. And for those of you who choose to pursue and continue providing inpatient care, patients will be sicker, your skills, the required skills will be greater, and I know you've gotten great training here preparing you for that. So change will be constant as we go forward. Clearly, we'll find new ways of providing care, we'll test new things, we'll learn, and we'll change again. We're already making great progress, but there's much more to be done, and we need you involved in that. Truth is, we'll go forward and we'll slip back. We'll have, it'll go, it won't be a smooth, continuous path. Change is not easy. We know this. I learned this, by the way, at Geisinger. So let me share with you a moment of learning about change. So I'm there as the CEO of the health plan. We have a cafeteria. We serve 700 people a day. We have the typical, kind of health system cafeteria, steaming tables with collections of meats and vegetables and starches, lots of starches. This is north central Pennsylvania, farm country. And the favorite lunch there was chicken and waffles. Do you have chicken and waffles in Ohio? Yeah? Like, here's how we made it there. A big waffle, right, on a big plate. 2-3 scoops of potatoes on top, chicken a la king all over it, beautiful. A couple of big scoops from a serving spoon of corn, right? And right on the top of it, a nice big hunk of hard bread. It's about 3,000 calories on one plate. It didn't feel like the right lunch to be serving for a healthcare organization, excuse me. So we brought up together a bunch of employees and we said, let's change our cafeteria. Well, they redesigned it, and we ended up in the place you might suspect, right? Very nice colors, light, airy, wraps, salads, yogurt. A beautiful thing. Well, people didn't take to it all that well. They gave me a hard time from time to time about the loss of chicken and waffles and, how much standardization, centralization we were going to do, and controlling and stuff like that. But it all went away and eventually people adapted. So at the end of my tenure there, they had a reception. It was a delightful day in the big cafeteria. There were, 700 people there or so, and people said nice things and gave me gifts. It was very nice. And up on the wall was a poster, and it said, "Good luck, Rick. Thanks very much. We will miss you." Chicken and waffles back on Monday. I never found out whether it actually came back. But we'll make progress. It'll go back. People will resist somewhat. But as we've learned from the history of the sisters, progress is steady if you stay focused, you stay persistent, and are doing the right thing for patients. Back to the primary calling, providing great care for people in need. To prepare for today, I reached out to some nurses I have known for a long time. I asked them what advice they would give you today. They represent over 200 years of nursing experience. Hopefully they're wise after all that, and here are their thoughts. First, be a lifelong learner. Today we celebrate you finishing the very beginning of your education. Change is constant. Embrace the opportunity to learn new ways of serving your patients. Be humble. Listen to your patients and to other people and learn. And be comfortable knowing that we all face a lifetime of learning. Never be afraid to ask questions. It's the only way to continually learn. And people's lives are in your hands. There's no excuse for doing something wrong because you are afraid to ask for help. Be courageous. At times, you will need to stand up somewhere. It may be in the OR, it may be on a floor, it may be in a doctor's office, and say, stop. We're not doing the right thing for this patient. Our job as healthcare executives is to be sure you're in an environment that makes you feel safe in doing that. One friend reminded me to tell you about the importance of being present and being in the presence of your patients. By this she meant being attentive, engaged, listening, and sensing what your patient is communicating. Many sisters that I've met over the last 5 months tell me that this means demonstrating, quote, I am here with you, body, mind, and spirit. Being present in the presence of the patients. This is really important in a world where we're becoming technologically so much more dependent on things outside of ourselves. Another friend told me a story that makes this point very powerfully. She said, sometimes just listening to how a patient responds to questions is more important than looking at test results. Your gut feeling is an undervalued asset. She said, I had a young dialysis patient newly diagnosed with end-stage renal disease. I was doing some teaching with him over the course of about a week. Although he appeared to be paying attention to what I said, he really asked questions and seldom made eye contact with me. He was not belligerent, but he was subdued and calm. It was not the reaction I'd expect to see when telling a 20-something that his entire life was about to change. He was going to be discharged, and his first outpatient treatment was going to be the day after discharge. He made an offhanded comment regarding not needing to know the phone number of the clinic because they would call him. I felt he was not dealing with the situation as I would expect, so I told the attending that a psych consult would serve him well prior to discharge. It turned out that he had been hoarding pills and was planning on committing suicide. The patient was held over in the hospital and went into counseling. After being discharged, he went to every dialysis treatment, eventually receiving a kidney transplant. What an example of being present in the patient's presence, open to everything he said, he did, and felt. When I told this story to my wife, she described it as a quiet, private act of heroism. I think that describes the wonderful opportunity and the privilege of being in healthcare. Patients open their lives to us when they are most in need, looking for our help. Our job is to listen, be responsive, be attentive, be accountable, be present in every way to ensure that they get our best. Every day across our country, there are thousands of private acts of heroism performed by people like you. They often go unnoted and unsung. They result from the dedicated commitment of nurses, doctors, and other caregivers, and from the soft, comforting, healing touch you all bring to millions of patients every day. Never lose that touch. And remember, coming from Mount Carmel, every time you touch a person, you're transmitting that healing presence of the Sisters of the Red Rover from 152 years ago. What a great opportunity and privilege it is to be a healthcare professional, to be a nurse, to make such a difference in patients' lives. So stay true to your calling to be a healing presence and help us find our way to making healthcare better for all. Congratulations on your outstanding accomplishment and enjoy the day. I wish you great luck and a wonderfully fulfilling career on the nursing path you choose.